For 40 years, the Ms. Foundation has always had the same mission: to fight all barriers to women's rights and empowerment, with a specific focus on marginalized communities, women of color, low-income women, and immigrant women. And we're very proud of that tradition. And over, of course, the course of our 40-year history, we have prioritized different women's issues because there have been different issues that have come up politically. And so we continue in our proud tradition of focusing in on what we think are the core issues of women's equality. The Ms. Foundation has always focused on marginalized women within the women's movement. Our concerns have not just been about equality of women with men, but also equality among women. And we have been very strong on that front and consistently spoken up on these issues. I believe that the reason for those discrepancies is simply embedded racism, classism, and cultural attitudes that cut across gender and cultural attitude towards diversity. And that is what, there's more work to be done for marginalized communities, and that includes low-income women who are not always women of color. The two most important factors in considering what the best states were for women and men were really health and economic means. In the worst states, we see women suffering from very high poverty rates, unemployment rates, diminished health. In the better states, we see essentially women being better off on those two overall scores. This survey was conducted by iVillage, and we chose to produce it and reproduce it because we thought it was important to think in those terms. I think access to healthcare is absolutely fundamental to our lives. In order to do anything, we need to be healthy. We need to take good care of our health. So I see it overall. But I think specifically in the area of economic justice, we have a couple of core issues. Without health insurance and healthcare, women will be unable to take care of their health and therefore engage in employment, just at the most basic level. We also know that healthcare is particularly necessary for women, particularly marginalized women, to be able to control their reproductive lives, to be able to decide when they have children and how they have children, if they will have children. And these have very profound meaning for a lot of women. We know that when it comes to low-income women in particular, having children can be the biggest important factor in whether they drop below the poverty line or not. And that's really a very important thing to remember. I also think that when it comes to thinking about childbearing, it's important to factor in the cost of childcare. Our government does not provide that. And the cost of childcare alone in many states exceeds the cost of university education. So how can women, in order to be able to make full choices, need to be able to understand the consequences of the lack of health care in these very important aspects of their lives. We think that the affordable health care will certainly help, but it is not enough. There's a lot of work that we in our nation must do to ensure that our marginalized communities have the same opportunities as everybody else. Specifically with respect to the ACA, we see the whole issue around enrollment of low-income women, and we want to work to make sure that low-income women and marginalized communities know their rights under that law and are able to access health care. We think and we know that there will be a lot of fights on this front. We already anticipate enormous battles around issues like reproductive justice, reproductive health, confidentiality for young people, and we stand ready to fight those battles and know that the work will not be done in the short term, but it is a long-term battle for equality for all. For 40 years, the Ms. Foundation for Women has been a profoundly avid supporter of reproductive rights and choice. We will always be in this issue. It has never been anything but a major priority for us. We have also, for many, many years and over a decade of grant-making, focused on the South because we understand the need to build reproductive justice and rights, communities and grassroots organizing and mobilization. We know that the law in Arkansas will be struck down. It is clearly unconstitutional on its face, and we are thrilled that many of our sister colleagues and organizations will be doing that. we actually live in a country today where the majority of people still support the ability of women to make choices, particularly as it relates to abortion rights. We are working with our grantees and with the larger community to ensure that this support for women's health continues. And it is, as you know, a continuing political challenge in our nation around which we must mobilize. More to do. The glass is only half full or half empty, and the numbers and statistics are simply shocking. The United States ranks 47th in the world on gender equity. Wow. I think we need young people to recognize just how profound that number is. We live in a highly segregated workforce. So, for example, of the 440 labor categories that are defined by our government, women are segregated in about 10% of those jobs. We also work and live in a world where women earn 77 cents the male dollar. For African American women, it is 62 cents. And for Latinas, 54 cents. Now, and then also let's look at the number of women CEOs of Fortune 500 companies. Only 18. These are profound realities in addition to the battle on women's health, in addition to the profound inequalities of our nation, which fall disproportionately on powerless communities, of which women are one. We need our young people, and we ourselves need to proclaim these facts loudly, because they speak for themselves, and they speak for the enormous work that we need to continue doing. We are a rich country only in economic terms. We are not a just and equal society, and that is the dream of America, which we must realize.